Good afternoon. I would like to extend my sincerest gratitude to the faculty, staff, family, friends, mentors, preceptors, and community partners who've all contributed to this momentous day. Thanks to your collective support, 462 new professionals are ready to begin making a difference in their communities. Thank you. To my fellow graduates, congratulations. My name is Daniel Brunick, and it is a privilege to have been chosen to represent the public health students graduating tomorrow. This July, I will continue at SUNY Upstate in the MD program. So I stand here as someone who has been shaped by public health and preparing to continue into medicine. And what a journey it's been. My classmates and I have overcome late nights, uncooperative data sets, and deadlines that seemed to approach faster than they should have. We studied systems, served our communities, and learned to ask harder questions about the world. One of the gifts of this program is how it changes your perspective. A headline becomes a policy question. A hospital admission becomes a systems question. Each number in a data set becomes another reason to care. This year, this new perspective has carried a particular weight. We studied public health during a time when many of the institutions that support it were debated, scrutinized, and tested. But rather than diminishing this day, I think that context makes our achievement clearer. It reminds us why the work we've been preparing for matters. More than a century ago, Theodore Roosevelt stood here in Syracuse and addressed the New York State Fair on Labor Day. And he was speaking to a country in transition. This country was wrestling with ideas of work, industry, fairness, and the relationship between individual effort and common welfare. Now, he wasn't giving a lecture on public health, but he captured an idea that sits at the heart of public health when he said that the welfare of each of us is dependent fundamentally upon the welfare of all of us. That idea has followed us through this program. Public health begins with the recognition that our lives are connected. Health is shaped not only in clinics and hospitals, but in everyday spaces, our homes, our workplaces, our schools, our neighborhoods, and in the systems upon which people fundamentally rely upon every day. And that's not a burden to carry today. It's something to be proud of. We've learned to see those connections more clearly. We've also learned to value prevention. Prevention is easy to overlook because when it works, the crisis is smaller than it could have been. The outbreak doesn't spread as far. The harm is reduced before it becomes another statistic. Public health often does its best work quietly. That quiet work deserves recognition, and so do the people prepared to do it. And that's why today is worth celebrating. We're not only receiving a degree, we're joining a tradition of people who care about what happens before the crisis, before the diagnosis, before the harm is irreversible. And this class has already shown the qualities that tradition requires. We've shown curiosity, we've shown persistence, we've shown a willingness to work with complexity, to learn from our communities, and to ask what can be done better. Those are not small things, And so to my fellow MPH graduates, I hope we are proud of what we've earned. We studied public health during a year when the field was being tested, and we're leaving with a clearer sense of its value. We leave with purpose, we leave with knowledge, and we leave with one another. So the message today is simple. Congratulations. Congratulations on the work completed, on the growth earned, and the commitments already shown. Congratulations to the MPH class of 2026 and to all graduates of the Norton College of Medicine. The world ahead will ask much of us, but today we should be proud of what we've already earned. Thank you.